Hello, my name is Neil and I'm one of the dentists here at Skirk Green Dental Practice. Thank you for joining me on this video today. I'm going to be discussing the dental implant journey and what that might entail for you. So let's find out. So we're going to start with an initial consultation, and that's really going to define the rest of our journey. It's very important at this stage that you tell us your expectations of treatment so that we can make sure that dental implants are the right choice for you and that you're aware of any alternatives. We're going to have a thorough look around your mouth. We're going to check the health of your whole mouth. We're going to look at the condition of the gum tissue. We're going to look at how much bone is available. And we're going to look at how dental implants might fit into your bite. We might do some additional investigations like x-rays or a cone beam CT. Now, a cone beam CT gives us a three-dimensional representation of your jaws to look at. So we can see not only how much bone there is to place dental implants into, but also where any important structures such as nerve canals or blood vessels might be. And we can also see larger structures such as your sinuses. This is all about identifying risks, planning for them, and really making sure that your surgery is going to be as safe and as predictable as possible so that we can get the outcomes you're after. Because dental implant treatment is a surgical treatment, and we take that very seriously. You'll find when you come in for placement that the room is set up for an aseptic procedure so that we can reduce the risks of post-operative infections to a bare minimum. There's more often than not a small cut around the area where the implant is going to be placed so that we can see the bone. And because we've planned all of this beforehand, we know exactly where the implant needs to be, it only remains to make space in the jawbone for the implant, and we do this with a small amount of drilling. Once this has been done, the implant can be placed and the gums replaced around the implant. And you have a dental implant. So healing generally takes place over a few months following placement. How long depends partly upon the complexity of the treatment. During this time, the bone is reshaping and fusing to the implant to give you that rock solid foundation that your tooth or teeth are going to need. So usually after about 3 months, we'll start taking impressions to get a custom crown, bridge or denture fabricated. This is going to be made to blend with your teeth to maximise aesthetics and of course function. How long it takes depends largely upon how many teeth we're replacing. So a single tooth or a small bridge generally takes a lot less time than a full arch bridge or a denture. Now finally, follow-up and maintenance is just as important as every other part of this journey. It's very important that we don't simply forget about the implant once it's placed and leave it. If we do this, there's a risk that the implant will start to become loose and eventually fall out. So it's very important that you have a good daily oral hygiene routine and that you have regular checks of your implants, because this is what's going to maximize the longevity of the implant and your investment of time and money in this whole treatment. So I hope this has been helpful, and I'll see you at the next video. Bye bye now.